Aloha, everyone, and welcome back to the Senate segment of Live at the Legislature. Today, I am joined by Senator Jarrett Keohokalole. Senator Keohokalole represents Senate District 24, which includes the areas of Kaneohe and Kailua. Senator, thank you for joining us.
Thank you for having me. Aloha. Good morning.
Morning. You know, this COVID-19 pandemic has really hit every community across our state. But Senator, what has the impact of this COVID-19 pandemic been for your district?
I think the first thing that comes to mind is the job loss. We had just a lot of inquiries from members of the community trying to file for unemployment claims. Many of them were able to actually get paid out. Some are still having difficulty, which is going to be an issue that we need to deal with this year. But just the overwhelming number of people who filed for claims is the first thing that comes to mind. And then the other is just a general concern from constituents who have reached out to us for information and help getting tested, understanding where clusters are, understanding how travel is impacted, and just how to deal with the disease in general.
You know, during this past interim, the Senate created a special committee for COVID-19, and since March, this committee has been busy trying to help the state navigate through this pandemic. Of course, you are a member of that committee. Can you share some of the work that you folks worked on during this past interim?
Sure. You know, in hindsight, after doing it for 10 months, I think the main thing we were trying to accomplish on the Senate Special Committee on COVID-19 was increased communication with the public, because that really was an issue at different points of the pandemic. And then also pushing a sense of urgency in the administration so that we had clear action being taken on some of these items that the public really was demanding some answers on. So for example, we initially called for the implementation of social distancing, for masks, for the mandatory quarantine, for better clarity on the plan to reopen schools in the summertime, and you know the response on testing and contact tracing, which ultimately led to the replacement of the chair of the Department of Health, and our visit to the Department of Health in August to identify whether their contact tracing operation actually could handle the surge that was taking place at that point. You know, the federal spend down of the federal CARES Act money, we really were involved in a lot, but it was mostly focused on making sure the state was moving with a sense of urgency to address the critical needs at any given point of the pandemic over last year.
Yeah, you know, so as we move forward with the vaccines of many across our state, you know, you've been the Senate's point person for many of these efforts. Can you talk about, you know, the state's vaccination rollout? I know later this afternoon, you and Representative Ichiyama will be hearing from the Department of Health on some of these matters. Are there any questions that you want them to answer, or is there any information that you are hoping to gain from this afternoon's hearing?
Yes. You know, this is the largest, I think it's fair to say that this is the single largest state government initiated public health action that we've ever had, trying to vaccinate 70% or more of our 1.4 million residents. We've done 7% of the population to date. Over 100,000 individuals have received at least one dose of vaccination. It is a really monumental task, logistically, strategically, to make sure that there is enough healthcare capacity out in the community for folks to come and get a shot, that we are able to coordinate with teams to go out to places like the care homes or the small nursing homes, so that folks who are not mobile but are at highest risk can still receive the vaccine. And then also make sure that we have clear communication to the larger community as to when their turn is, whether they can go as a caregiver, what essential workers mean, what that actual designation means, and then how much vaccine we're getting at any given point, and whether it's being distributed effectively. So that's the main thing we want to discuss today is who's up in the queue right now, specifically, how things are going on the different islands, because the vaccine administration just is different by island. Some communities are much smaller and more difficult to get to and have less capacity. Healthcare workers there to monitor individuals who get the vaccine to make sure they don't have allergic reactions versus, in Honolulu where you just have massive demand and it's more of a logistical concern to make sure you're feeding everybody through safely. And we don't have these long lines like you've seen in Florida and other states, on the news. So, my main prerogative as the chair of the Senate Health Committee has been to make sure and push the department to put out communication to the public to make sure that there's a good an understanding of what's happening and where we are on the vaccine at any given point. Ultimately, it's a function of supply. We just don't have all the vaccines we wish we had, and that we could actually deliver if we did have them in hand. So we got to continue to have that dialogue with the public so that they understand what's going on and can come and get it when it's ready.
Earlier this week, members of the Senate Special Committee on COVID-19 visited the pod, or the point of distribution at Pier 2, and the members were able to see, how massive of a operation these pods are. You were at that site visit. What were your thoughts of seeing the operations firsthand at the Pier 2?
I thought it was great. I was particularly grateful to the healthcare community. HPH and Queens, all of the healthcare community, private community, has really stepped up, taking the responsibility on themselves, put in their own money and their own people to make this happen, because there's a general recognition that we are one community, we got to work together. And there's an incentive. The fact that we can get so many people vaccinated at those large sites that Queens and HPH are operating means we're going to have better outcomes. We're going to have less kupuna who are at risk and who will ultimately end up getting sick, going in the hospital and dying if we can get those shots in arms as soon as the vaccine comes off the boat. And really, we do need them. We need the private sector to do this because we're just not equipped to handle the largest public health operation in state history. So it was really encouraging. It was very meticulous. They put a lot of work into it. It's continually changing so that it can meet the needs of the public. And so I was encouraged.
Thank you, Senator, and thank you for joining us this week. And we will see you next week on the Senate segment of Live at the Legislature. Mahalo.
What are you doing? We have to go. I'm gonna be late for work.
It's Tuesday morning. I gotta record live at the legislature on Alelo. Senate and House leadership discussing what's happening at the state capitol.
So just watch it on the news tonight. Come on, let's go.
Hey, this is like getting the news before it's news. If only I could get this remote to work.
There. Can we go now?
No DVR? No problem. Watch Wednesday evenings at 7 p.m. on Channel 49.